So with the plasma pen, it stimulates fibroblast activity. So it's, again, creating that collagen and elastin in the skin. Again, kind of like the radiofrequency microneedling. It is creating it longer. So your skin might appear that it's healed, but deep down in the surface it's actually not healed. So in that 2 to 3 weeks time, it's going to look like it's healed after those little dots fall off. But really, we can only treat with that pen every 8 to 12 weeks. It's amazing for the eye.
For the eyelids. Yeah, like why do our eyelids get so weird when we get older? It's like there's extra skin. Are you looking to defy age without using Botox or filler? Today, I have a very special guest. I have my esthetician, Jenn Diller, here with me from Revived Medical Aesthetics. And we're going to have a conversation today with you, whether you're in your 20s, 30s, 40s, on how to kind of reduce fine lines and wrinkles, boost collagen production. A lot of our community and listeners are in that 30, 40, 50-year-old range. I'm approaching that 50-year-old range, and I'm trying to defy age as long as I can. I know it's totally like vain, but that's where a lot of women are these days. They're looking for something that's more natural, and so you offer that. So Jenn, tell us a little bit about your background, how long you've been in aesthetics, the kind of your additional training that you're doing, and then we'll dive into some of these treatments that you offer.
Okay, so hi everyone. My name is Jenn. As Jenn said, I'm a medical esthetician, so I've been in the field for about 8 years. I actually have a background in nursing, so as my career goes on, I'm actually in school for nursing as well, so that I can eventually inject and do all of the things. So,
which is so fun. Yeah. Another conversation we will definitely bring to you.
Yeah. So I do everything from lasers to facials to microneedling, and which we're going to get into that a little bit here soon.
Yeah, I'm so excited to have you here with us today because I feel like when I was maybe a little bit younger, I was curious about what treatments are out there. What is the best treatment for me with my skin type? If I have a budget, what is the best one that's going to give me the most bang for my buck per se? So one treatment that I have actually had recently that you performed on me was microneedling with radiofrequency. So let's dive into that. So needles scare lots of people, right? Mm-hmm. So maybe you can. So I will tell our listeners, those little rolly what are they, derma roller things, right?
Right.
So maybe you can tell us why those aren't going to work, and I'm sure we'll go through all of the things, but the needle size and depth and what we have to do. So maybe describe what microneedling actually does to the skin, and then we'll kind of go through.
Yeah. Well, I'm so excited to be here as well. So thank you for having me. Derma rollers are not my favorite. I know that you can buy them in TJ Maxx. You can buy them on Amazon. And the reason we say we don't like them is because clients will say that they have them in their bathroom for months and months and continue to use them and not clean them. One of the biggest things about them is that they're not sterile.
Right.
So also one thing about those is they're created more for a one-time use, and then you get rid of them. But I just say stay away from them and leave it to the professionals so that you... Right. One of the things that happens with those is you get little micro tears, and you may not see them in your skin, but they're there.
Yeah.
And if you're not doing it properly, that you can get infection. So we want to try to avoid those things from happening.
Right. Because it can probably actually cause more damage. So
and then you have to go back and correct it with another procedure.
Yeah. The size of the needle on those little micro rollers is it like 0.2 or something? It's very, very small. Yep, but to get into, is it the dermis layer is where you actually have to get the needles that you guys use. I think you can change the length.
You can.
They can go very deep.
Mm-hmm. So one of the things with the microneedling pen is there's several different types of pens that you can use. Different med spas have different pens. It doesn't necessarily mean that one is better than another. We actually have 2 different pens at Revived. They're both amazing, but one, like you said, gets a little bit deeper in depth for those acne scarring clients or fine lines. When you're doing less depth, that's more for your fine lines and your wrinkles and more for just a rejuvenation. When you're going deeper in depth, you're doing scarring and deeper fine lines and wrinkles.
Okay.
So
Yeah, so maybe let's tell our listeners, if someone were looking to get microneedling treatment, it would be for fine lines,
Yep.
wrinkles,
Fine
acne
lines.
scars,
You got it.
pore reduction, right?
So smaller
Yeah.
pores, fine lines, wrinkles, pigment, scarring, hyperpigmentation, melasma. And once we get into kind of the procedures, melasma is a super tough thing to treat. It may never fully go away, but microneedling is one of those things that's great for all clients, to be honest, whether you're in your, like you said, 20s,
Mhm.
30s, 40s. Um, we can do more of a rejuvenation or a deeper treatment that gets really in there and starts building up that collagen, elastin production. With microneedling, what it's doing is causing little microchannels in the skin, which is causing that healing process. So that healing process is what's building that collagen and elastin in the skin, which we all want. That's going to produce the more youthful look, and continue to build that collagen and elastin.
No, that's awesome. I know I heard a doctor actually describe it as using the analogy of aerating a lawn. So you're putting holes down where the roots are
Mhm.
so that the grass can grow stronger. Which is interesting because we might look a little rough after the actual procedure is done. One area that I would like to try to have some microneedling done is my neck. We've talked about my neck. My mom, I just feel like she gave me this real long neck, but that seems to show aging, décolleté. But that's a really good treatment for that area, right? And I think you said
Yep.
you heal a little quicker there. Is that correct, or is
We're
that
actually
wrong?
here a little longer.
Longer? So I have it mixed up.
Yeah, that's okay.
Okay.
So when you're treating the face, basically what happens is you are red like a sunburn.
Hmm.
After that, the second day you kind of peel a little bit. Not everyone peels though. If you don't peel, it doesn't mean that the treatment's not working.
Right.
So you kind of turn pink the second day and then have that little bit of peeling. I always tell clients like 6 to 7 days of downtime. When you're getting a little bit older though, it can take a little bit longer for you to heal, but anywhere that you're treating from the neck down actually can take a little bit longer to heal.
Which we learned with my procedure we decided to try.
So whether you're treating your neck or your arms, or your stomach or your legs or wherever it is. And it's the same thing when we get into lasers. We can talk about that a little bit too. It just takes a little bit longer.
Mhm.
Body process is just a little longer.
Yeah, well, we're a little bit older, so
But
there
yeah,
are
the neck
some.
is the neck's amazing. It helps. As the generations go on, tech neck is real. And
Technic.
it's tech neck, it's happening. We're looking down at our phones, and I always try to stay cautious and like, here's my phone. Like
Yeah.
when you look up, it doesn't happen. We're all looking down.
Right.
When I'm treating clients, I'm looking down. It just happens. It's not something that we think about all the time. But
Sure.
if you're doing these regenerating procedures, you're helping those lines diminish, maybe not fully,
Sure.
but help to soften them because we're
Yeah.
always looking down. Like I said, we're always doing
Right.
repetitive movements.
Mhm.
So it definitely helps.
Yeah, and you brought up a good point, like, it takes a little bit longer to heal, but are there additional, things that you can do? Is it, like, plasma-rich platelets? Is that what PRP? Is
Yeah.
that what it's called? You
Yeah.
can add that, and there's
Absolutely. Yep.
some
So
other
you can
things?
get your plasma drawn,
Okay.
and we can incorporate that into the treatment as well. So basically, we are just microneedling that in.
Okay.
We also have some fibers from other companies as well, and the lab grown. So things like that
Help speed up recovery.
But your body obviously is the best
Sure.
to do that.
Sure.
It does help speed up that recovery. Yes.
Okay. And then radiofrequency can also be added as an add-on to microneedling. And that's actually we can talk about my stomach. So
Yeah.
I had 3 babies, all 9 pounds, 9 pounds, and then 9.8 was my last one. And I'm kind of narrow. So my stomach Jen has seen my stomach. It's been stretched out. There's skin that I don't love. It's a little bit crepey. That's what I say. So I'm always trying to kind of rejuvenate that the best I can without undergoing surgery or something like that. So we had the idea, let's try some microneedling on my stomach, and the needles can hurt if you aren't numb. So
Right.
that's probably a good point. Like people hear needles and they're like, I'm out. That is not a procedure I will do.
Mhm.
But you're numb. right? Like, so you put the numbing cream on. It really doesn't hurt until the numbing cream wears off.
Right.
And then there was a couple sensitive areas towards the end. And I was like, well, I would laugh. That was my reaction. I would laugh.
And
when
people do that too when they're in pain. But you're right. The traditional microneedling, honestly, you numb for 45 minutes and then it feels almost like a cat scratch.
Yeah.
feeling.
Yeah. It's not.
And then you feel more of the vibration. But when you're getting into the radiofrequency microneedling, that's a little bit different because the gold needles that are going in and out, they are providing more of a skin tightening. So that's why that treatment's a little bit more. I won't lie to anybody. I do say it does feel like little bee stings.
Yeah.
And not to steer anybody away from that because it's an amazing treatment. And because you're getting more skin tightening, it's definitely worth it for your
it's
laxity skin, your crepey skin, maybe your stretch marks, things like that. If you want something that's just a little bit more, that's the treatment for you. But you numb typically for an hour from that. But you're right. As soon as that numbing starts to wear off, you do feel it. And if it's too
you got more numbing cream on me, so it's not like intolerable. I mean, I home birthed babies, but I think I can take pain, and I don't think that's to say that someone who has a low threshold of pain couldn't tolerate it as well. So let's talk the radio frequency. So the benefit to having that as an add-on is it's kind of heating the skin up. Is that correct?
Yep.
Okay.
So it's heating the skin up more, which causes that skin to tighten. So someone that comes to me and says, I have really lax skin, really crepey skin, or my fine lines and wrinkles are a little bit deeper, I'm probably going to put them towards that treatment instead.
Yeah.
Every once in a while you get a client that, it's a little bit much for them, but I will say I've never had somebody that couldn't make it through it.
Sure.
So, you do feel it, but I mean, pain
it's
is
worth
beauty.
I know.
Pain, so
That's a good quote, yeah.
It's so worth it.
It is. And I think
it's your own body.
Right.
That's causing, that damage,
injury.
and then healing it. So.
Yeah, which is amazing. And then the results are interesting how you heal. So it's not like a Botox. You get an injection and your face in like 2 days is like think.
Right.
It took some time. So I did have, and you prepared me. You let me know like you probably have a few weeks of swelling, healing. Swelling didn't last a few weeks, but my stomach did kind of pooch out a little bit from the swelling. And I sprayed some of our after sun soother, had some really comforting oils, helichrysum, tea tree, lavender. So I was using that, which helped a lot. But the process did take a little while. And then I feel like now so what was it, January we did that? I feel like now I can really see results. I probably should do it maybe one more time. I don't even know if it would be necessary, but the results were really nice. But I just wouldn't want someone to get it and think like an immediate result. Now you may see a little quicker result with maybe pore size reduction, fine lines and wrinkles, maybe a little bit sooner. I think that my stomach was a little more of an area of stretch marks and extra skin, and just it was a little bit extra. It would take a little more. So
yeah, and as that collagen builds, I will say too, with the radiofrequency microneedling, your collagen is building longer than your traditional microneedling. And I say traditional meaning the pen. So because you don't have the needles going in and out and causing that radiofrequency of tightening, it maybe will build for probably like 2 to 3 months after the treatment. But when you look at the radiofrequency microneedling, it truly builds for like 6 months after the treatment. Wow. So there's a difference there. And obviously price is a difference as well. But they're both amazing treatments. It's just really what you're looking for. And when you're treating radiofrequency microneedling with the neck and the face, it's a little bit of a different healing process. So as you notice with your stomach, like those marks still might have been there. The pigment from those marks might have still been there. But when you're treating the face and the neck, the first day you're red like a sunburn, and then you turn pink, and then you can feel the marks, but you don't see them, and nobody can see them, even with the neck, which is kind of crazy because when you're treating the rest of your body, like I treated my lower abdomen, and oh my gosh, this is such a different experience, because when I treated my lower abdomen, those little, they almost turn like crusty, like
little dots all over.
Yeah, but you could see them versus doing the face. So
good to know.
And that's why I say like neck down always heals a lot differently.
Yeah, that's really interesting. I know because I'm always, when I come to you for a treatment, I'm like, I cannot not wear makeup for like 2 days. And so you're like, oh my goodness, we're limited here. So how long till someone could, maybe be on a Zoom or want to go out in public after a microneedling with radiofrequency treatment on their face?
So I'll be honest. It's a question I get all the time. I tell clients, I go out, people are going to look at you. But honestly, in the end, it's going to be worth it.
Yeah.
Because you know what your skin's going to look like. You know what it does to you. It's bad stuff. But honestly, you can go out the next day. You can be on Zoom. But if you do go out, one thing I always stress is make sure that you're wearing your sunscreen. If you need to wear makeup, I always try to say wait at least 48 hours. If need be, if it's the next day, you can wear makeup. Just take care of your skin and the healing process as well. But sunscreen is a must have because we are creating new collagen and elastin. So we don't want to interrupt that healing.
Right.
When you're in the sun and you're creating new skin, you're damaging it. So then we're going back to square one and maybe even back a little bit farther.
Right.
Kind of get it back to where we need it. And then we're starting all over.
Okay.
So yeah, you can go out. Just make sure you're protecting.
Yeah.
That's the biggest
Makes
thing.
sense. Makes sense.
Yeah.
So I know pore size is an issue I've talked about, like, so the girl that does my makeup, I'm always like, let's make these pores look a little bit smaller. So it is kind of an interesting theory that you poke holes in the skin where there's holes, because what a pore is where the hair follicles, right, like coming out. So those get a little bit larger. Mine are here. Like, I think that's a common area. So yeah, maybe explain to women who also have that as something they're a little bit self-conscious about, how it's going to work probably the same. I don't know if it's necessary to really go down a rabbit hole of it, but it would be probably the most effective treatment, would you say?
I honestly love microneedling. It's one of my absolute favorite treatments, as I might have said before. But I'm basically tearing up the top layer of the skin, and then it's creating, again, those micro injuries. So it's essentially closing up those pores. So better if you're someone that loves to wear makeup and you struggle with pores, it is great because it is closing them up. But with all of these procedures, you want to be patient with it.
Right.
Because it takes time to build collagen and elastin in the skin. So being patient is one of the biggest things. It's not going to happen overnight. It might not happen after one treatment. I always tell clients to aim for 3 treatments. Let's reevaluate and let's go from there. Because I mean, maybe you're in your 20s and you're okay with just starting to rejuvenate your skin and keep what you have.
Yeah.
But that's different than when you get into your 30s and your 40s. Our skin is changing. Elasticity is gone.
Yes.
And one of the biggest things is we lose 1% of our collagen since we have been 25.
Isn't that terrifying?
So if you're not doing something
to
rejuvenate and build that collagen and elastin, you're just going to keep going.
Yeah.
It just really depends on what age you are. And again, being patient is huge.
Sure. So if someone was kind of looking to avoid injectables and things like that, would around the age of 25 be a good start for microneedling? Is that like, and what would be like a good maintenance program? You think it would be like once a year? And then if they have never done it and they're in their 30s or 40s, maybe what would that look like to try to rejuvenate that skin, start the process of reversing some aging?
When you're in your age, in the 20s, it's a preventative phase. Okay. So you are looking at maybe treating once. But if you are someone maybe that had acne as a child and you're dealing with acne scarring, that's looking more like let's treat every 4 to 6 weeks. Sure. Let's start with 3 treatments and then let's go from there. Okay. Again, we can evaluate and then see if we need more treatments or if we need to switch up the treatment from microneedling to something else, maybe a laser of some sort. When you're in your 30s, you're doing maintenance and early prevention. Because again, when you turn 25, you lose 1% of your collagen. So fine lines and wrinkles are getting more and more prominent. If you laugh a lot, those smile lines, if you're not wearing sunglasses, you're getting crow's feet, which we need to correct as well. And a lot of clients are not wearing sunscreen. They're not wearing sunglasses. Those are the 2 essential things you want to have and you're using all the time to help prevent as well. When you're in your 40s and beyond, you're looking at correction and rejuvenation, especially if you're coming in and you haven't done something to prevent when you're in your 20s and 30s.
Sure.
Now we're looking at more treatments, that every 4 to 6 week mark, to make sure that, again, we're building that collagen, elastin, and stimulating that as well, is very essential. And again, when you are having deeper fine lines and wrinkles, again, 4 to 6 weeks is what you're looking at. Starting always with 3 treatments, and then it may be where we're having 6 treatments instead of
Sure.
4 or 3.
Yeah. So it sounds like go to a good, reputable esthetician. I recommend you if you're in the central PA area. And then it's going to be individualized, more or less.
Yep.
Every person's skin is unique and different based on pigment, fine lines and wrinkles, scars, and all those sort of things. So it is an individualized thing.
Right.
And you guys do consultations, right?
We do consultations.
That would be an option if they just need to like hear about it, get their feet wet.
Right. And not everyone's skin is the same. Not everyone's skin can be treated equally, whether it's pigment, scarring, wrinkles. And I have a lot of clients that, can I do a Zoom or can I do a phone call consultation? Honestly, being in person is the best.
Right.
So we can assess the skin and exactly what it needs. And the way I approach my own skin is with different modalities. I do chemical peels, I do laser resurfacing, I do IPLs, I do microneedling, I do all of it.
Yeah.
It's all stimulating collagen, elastin building, but just in a little bit of a different way.
Yeah, and it keeps your body legs change, like, because then it has to keep guessing on how to heal and promote that new fresh skin. So would you say microneedling might be your number one favorite treatment or no?
I would say it's probably my number one. There's different laser resurfacing treatments though that I love.
Okay.
Of course, I love to go hard on every treatment that I do. I like to see those results. You don't have to go hard all the time, but I'm someone that likes to go.
Yeah. Like
a little bit tougher.
Let me test this and see how it is.
Yeah. But I would say definitely it's up there for sure.
It's one of the top.
Yep.
Okay. And super trending. I feel like in the modern aesthetic world, it's just huge.
I feel like when I started this almost 8 years ago, I didn't hear it that much. I felt like it was popular, but it wasn't one of those treatments where everybody's like, let me do it. Now on TikTok, Instagram, everything, I swear I see it all the time, and everyone's talking about it. Plastic surgeons, everyone.
Yeah. I was actually listening to a plastic surgeon talk a little bit about a lot of women trying to get a little bit away from filler with maybe not the lips. That's one area. He said they still are, because when he's been doing facelifts, even though they say that filler only typically will last 1.5 to 2 years, they're finding that some of it is still laying in there for years and years and never going away. He said it's the sugar. What is that sugary stuff that's in filler? But anyhow, he just says that it's in there and they have to like remove it before they do a facelift. So yeah, it seems like people are kind of going injections with filler were huge for a while, and people are now trying to go a little more natural route. Yeah. So
I find that it's a lot of clients talk to me about it all the time. They typically come to me first, but as we talked about a little bit earlier, and we can get into it at a later segment, but some clients want that instant, and that's again going back to what I said. This is not instant. You will see results after the first treatment, but continuing your treatment and building that collagen elastin. You don't want to just like do one and then quit. That's it's not going to get you to your desired results.
Yeah. And so it would be a few consecutive treatments, and then you could go to more of a maintenance.
Right. Exactly. Yep.
Okay. Awesome. Is there any contraindications, like certain people should not do microneedling? Is there anything like that?
I would say I feel like a lot of people there's not much there. When you're doing retinols and things like that, I always say like stop those 3 days beforehand, because if you do end up peeling, you might peel a little bit more. Pregnancy, I feel like there's a little bit of mixed reviews there. Some people say if you do a light microneedling, now obviously I'm not a physician, so I don't want to say that that's okay or not okay. But again, clients with melasma, all fits, can do microneedling. I would say maybe younger teens, let's kind of evaluate the age there, just because they're still growing. But I feel like more and more clients that are younger coming in with acne scarring. So
Yeah.
that's huge. I'm trying to think of anything else. Like acne, I think there's a little bit of mixed reviews there too. When we're treating acne scarring, it's great. But I have been seeing a lot on like active acne. Can you microneedle over it? I typically say let's wait. Let's try to do maybe a chemical peel or maybe laser to kind of get that acne to not be as inflamed.
Sure.
And then let's microneedle after. So I'll take different approaches that way.
Sure.
But I know there is some reviews out there that people are doing microneedling over active acne and they're seeing good results. But
yeah.
I haven't really dipped my toe into that.
Right.
So I don't know. I'm still kind of researching.
Because that could be super tender. Yeah.
Yeah.
Because acne can be very,
Right, and
especially.
And the thing that we look at with that is that we are spreading bacteria all over the face. So that is not my approach that I take. I like to get the skin pretty clear first and then
Makes
go in
sense.
that way.
No, that's awesome. So tell us what that treatment looks like, why someone would choose that as a treatment option, what might be going on in their skin.
Yeah. IPL is also one of my favorites. And I'll tell you, it's one of my favorites because I don't know why. I feel like I never had rosacea, but I mean, to be a little personal, when I gained weight, it's an inflammation response. So like your body is working a lot harder. So I got redness from it, and IPL was my best friend.
Oh, love it.
Especially, I will say it, when you get a little bit older and you blow your nose too hard, or genetically that you have broken capillaries.
I see them on my face. Yeah, we've talked about using that.
They're tough to get to go away. But IPL, intense pulse light, either treats the blood vessels, which are your spider, your capillaries, capillaries, or it treats pigment in the skin. So hyperpigmentation, aging spots, freckles. It treats one of two of them.
So I can go freckleless.
Yeah.
I'm a redhead by nature, so I have the freckles.
And what happens is when you treat reds in the skin, it's basically taking those capillaries and breaking them up. It's kind of bursting them, and it is cleared through the body and then lymphatic system and processes waste. So drinking lots of water, sleeping a little bit elevated, and we can kind of get into that as well. But when you are treating browns in the skin, what happens is they get darker. And over the next 2 to 3 days, they kind of slough off, kind of like shrubbery.
Yeah.
So making sure that you are not picking at those is essential because, again, we're going to go backwards and then we have to retreat.
So would age spots fit in that when you say like browns, those, what do they call them, like liver spots? People.
Yeah, I know. Yeah. You don't hear that too much.
I know.
Yeah, you do. Yeah.
As leech spots.
Yeah. Yeah. So
that would be someone who would be a good candidate, freckles or these little broken capillaries. What is the biggest age group that you see using this?
Yeah. Oh, I'm going to have to say it's a wide range. Okay. I want to say it's anywhere from 30s to 70s.
Really?
Yeah.
Oh, isn't that fun? I love it when the older ladies come in. I mean, I'm going to be in that age group at some point. I hope to make it that far, but I love it when they take care of themselves like that. That's fun.
Yeah.
So what does IPL feel like when you're having it done?
So IPL, and I'm always honest when it comes to treating with, anything, because I don't want you to go in blind. Right. You're literally blinded because you have glasses on. Yeah. So you can't see anything. But basically what we do is we apply a gel to the face. And then it feels like a rubber band smacking on the skin. It's pretty quick. It takes about 20 minutes, depending on what part of the body we're treating.
Okay.
Typically the face is like 15, 20 minutes.
Okay. Yeah.
And when I've treated arms. I do treat arms. I treat chest. I treat legs. It's amazing. And sometimes you do, again, it's the same thing as microneedling. I always say, let's start with 3 treatments because we don't know how deep that pigment is. It's going to lift little by little. And that pigment's going to continue to come to the surface. The same thing with the blood vessels. We don't know where that source is feeding from. So it can be kind of difficult.
Yeah.
And we also have another laser as well that can treat broken capillaries as well. That doesn't have much downtime, but when we're breaking them, sometimes they can cause a little bit more damage and take longer to heal.
Okay.
But yeah.
So sun damage as well. If you've been out in the sun a lot, that would be a good choice. So I know that I have one, well, it's this side of my face where, because I think the way my hair is parted, it has more freckles and sun damage there than this side is just, I've always parted my hair that way.
It's
But
funny you say that now, that you think it's because you parted your hair.
so is that wrong?
I'm going to say I think it's because your car is right there.
Oh, I didn't think of
So
that.
a lot of people don't think that.
Yeah.
Or think of that. And yeah, there's actually a study which is pretty cool of a truck driver
Yeah.
who I love the photo. I'll have to send it to you later tonight. But one side of his face is all just wrinkly and hyperpigmented from the sun, and the other side is more just like an aging normal guy. Yeah.
Wow.
So it's crazy because we don't think of that. And that's why I always say, like, sunscreen is your number one best friend, and you should be using that.
Yeah.
But yeah, aging is.
That's fascinating.
Yeah.
Is there any fun scenarios that you saw in the med spa where you were like, I cannot believe this is like the result we got? Or is it pretty much standard? It's always kind of like, this is what we see.
I actually love seeing before and afters with this treatment because a lot of clients, you know, whether it's any approach that we take, microneedling or lasers, some clients think that there's just no hope.
Sure.
And then when they come in, I don't even need to look at my before pictures. I get so excited and I'm just like, oh my God, your skin. Yeah. It looks so good. And they're like, I know. So-and-so said that I look like this at my bridge club or whatever, my book club or whatever it is. Guys are super fun to treat too.
Yeah, you guys have had more men. I remember the one day you're like, I had a guy before you. And I was like, really? Like, tell me about that. Yeah, like, that's
some
fun.
people think that guys, I mean, other guys, they're like, other guys that come in here. I'm like, yes, they do. They might not advertise it, but I mean, I actually treat a lot of guys for red in the skin. Maybe they're still hardworking. I don't know. Their blood is pumping. I don't know.
That's fun.
But I will tell you, I have a few guys that treat red, and it's so cool to see as a guy because guys don't dive into like the products and things like that. And I think it's actually really cool and brave of them to like, okay, I want to do something for my skin.
Right. And they're not wearing makeup to hide the reds or things like they're bare skin in it, right?
Yeah, you're right. And women, like we have those. I mean, guys can use makeup.
Sure.
Absolutely. But you're right.
Yeah.
A lot of guys aren't. And they're just like, oh my God, I want to treat this. Like, my face is inflamed. So it's so cool to see.
Yeah.
But going on that, I will say aftercare is big. And one of the things that I say when we're treating with the IPL, especially reds, because your blood is already pumping. I mean, your face is already inflamed. I do not drink 24 hours post. I
like
try
alcohol,
to
right?
Yep,
Yeah,
you got it.
Okay.
I do say try 48 hours only because the dermal damage from that and like, again, your blood is pumping, your face is working harder. It's the same with like working out. You want to make sure that you are not working out, having doing 25 burpees or sit-ups or whatever is going to make your body inflamed even more because you could actually interrupt that healing process.
Yeah.
And then it could be a lot longer that you take to heal. You could be red longer. You could actually cause some more inflammation to your face.
Yeah.
And then
people don't like that.
Right.
So it's good that you are explaining that, telling them, you know, just be good for a few days. It's worth it. And
drinking lots of water is always essential with any procedure that you're doing because your body is promoting that healing.
Yeah.
So we want to take that step. And I mean, our bodies are the largest organ.
Yeah. Skin is
drinking
huge.
Skin.
Yeah. No, I gotcha.
Sorry. Drinking water. Definitely drinking water is the number one.
Yeah.
Sleeping a little bit elevated.
Okay.
No alcohol. Those are like the three things.
Yeah.
Like make sure that you're doing.
Yeah. And those are simple enough if we're being diligent.
Yeah.
So I remember.
And sunscreen. Sorry.
Yeah. I know you promote that hard. It's good. It's good. The IPL. So when you talk about treating reds and browns, can you do them both at the same time? Is it a different?
Yeah.
Okay. So is it the same treatment? Is it?
So
I don't know enough.
The machine that I have is sometimes it's just as simple as switching.
Okay.
on the machine itself, but we actually take out the head and switch out another head. But absolutely, you do 2 passes, whether you're treating face or body.
Okay.
We typically treat with reds first, and then we'll go in with browns.
Okay. Because I have the little broken capillaries and I also have
Yes.
freckles. So I would need to hit both.
You can do both. Another question that I get asked a lot is, can I numb?
Yeah.
No, we don't want to numb
Okay.
procedure because we need to see how the skin reacts. And we can't see that when you're using numbing cream, because numbing cream, even when you numb for microneedling, it actually looks like your pores filled in a little bit. So we need to see that response from the body.
Yeah.
So
And you said it just
same.
feels like a rubber band snapping. I don't remember. Did I have the photo facial? It was like two different.
That is what that is.
Oh, okay. So I've done that, but that was a while ago.
Yeah.
I think Carrie did that on me. Way back when I think I first found the med spa. Yeah. So
another thing that I wanted to bring up too, when you said about like your hair and things like that, and I think that you like Color Science, the product. They actually have a powder screen.
Okay.
And some of my clients had said that they are putting it on their scalp. And I was like,
oh,
brilliant.
like to hide the grays?
No.
Oh, just to
protect your scalp from burning.
I'm like, hey, let's go with these.
Yeah.
Oh, because I mean, there's been times where my scalp has peeled because I have a part and the sun's beating down, and
so there's sunscreen for that too.
Okay. Cool.
So you can protect
everything.
Amazing.
That is amazing. So tell us exactly what the plasma pen is doing in the body to give us the result that we would like.
So with the plasma pen, it stimulates fibroblast activity. So it's, again, creating that collagen and elastin in the skin. Again, kind of like the radiofrequency microneedling. It is creating it longer. So your skin might appear that it's healed, but deep down in the surface is actually not healed. So in that 2 to 3 weeks time, it's going to look like it's healed after those little dots fall off. But really, we can only treat with that pen every 8 to 12 weeks.
Oh, wow.
So those little dots, again, after they fall off, it's going to continue to build that collagen and elastin. I know you said something about your eyes. It's amazing for the eyes.
For the eyelids. Yeah, like why do our eyelids get so weird when we get older? It's like there's extra skin.
You know what? Now, I will say that some clients have it just genetically.
Yeah.
I know it runs in my mom's side of the family, so it kind of scares me a little bit.
Yours look great. Yeah.
But I do the treatments too, to just kind of help rejuvenate them and keep them lifted. And a lot of clients, they want to do the bleph.
Okay.
It's huge. You can do upper and lower, but if you're not ready for that, or it's expensive.
Okay.
So if you don't have a pre-existing condition, a lot of surgeons won't approve it. Insurances.
Yeah.
This is a great way to go because it's your own body's natural response to healing.
And when you say bluff, you're talking about the surgery. What is that full surgery called?
Blepharoplasty.
Yes. Yeah. And so they essentially are taking some skin out.
Right. They're cutting it off. Yep.
And pulling it out.
Lifting it up.
Yeah.
Exactly.
So,
and they're doing it on the lowers too. So,
like down here.
You got it. Yep. I will say, with the radiofrequency microneedling, that one feels like little bee stings. This one is essentially what I'm doing is creating almost like little micro burns.
Okay.
And that is exactly what it feels.
Does it smell like skin burning?
It does. Yes. Yes.
Now, does this hurt? Are you numb, I should say?
You are numb.
Okay.
So with the, and I'll go back a step here. With the traditional microneedling, you numb for about 45 minutes.
Okay.
If I didn't already say that, the radiofrequency microneedling is about an hour.
Okay.
With this procedure, the plasma pen, it's also an hour.
Okay.
Sometimes clients numb again right before the procedure. If I'm doing one eye, then we'll do the other.
Yeah.
This is probably the hardest procedure to get through sometimes. I never, again, it's the same thing with the other procedures. I never had someone not come back and do it again. Or I've had clients say, I'm never doing this again, Jen. And I've had friends say that to me too. And I will tell you, they come back.
Yeah.
Because those results are amazing.
I
and
bet.
It's so cool to see because it's not only helping with the skin tightening. It's helping with the lax of the skin. It's helping with the crepiness. It's helping with the lines that we get under because we're going the whole way around. So the crow's feet as well.
Yeah.
A lot of clients have darker pigment under their eyes, and sometimes that's genetic too. They're is so hard to get to go away, but
so that actually will lighten the
pigment.
It will. Oh, that's fascinating.
So it's such a cool treatment, and you can do it all over your face. You
Okay.
can do it on your arm. You can do it anywhere.
Wow.
On your foot if you wanted to.
Yeah.
That's doing on your foot, but anywhere you need to.
Yeah.
You can
That's
treat it.
amazing.
And it's the same thing with the lasers and things like
So we could do that on my stomach.
Yes.
I wonder if that would be an interesting.
We should do it. Oh my God.
We can't do it right before swimsuit season. How much time till swimsuit season? Like,
So yeah, we should probably do it.
Would it be
this week?
Yeah.
Or next week?
Yeah.
Yeah.
We better do it like tomorrow. No.
Yes. Tomorrow. I'll fit you in.
Yes. You got me.
That is another procedure.
Yeah.
Same with the radiofrequency microneedling.
Yeah.
You want to plan for that downtime
Mm,
and
sure.
allow it to happen. Allow that collagen elastin building to happen because, again, it's not one of those things that's going to just work overnight.
Yeah.
And you may need 1 to 3 treatments.
Okay.
I would say you could always start with 1. And then again, same with everything else. Let's evaluate and see where we're at.
Yeah.
Maybe we can switch to another treatment. But I will tell you this as well. Not all treatments are safe for upper eyelids.
Okay.
Only some lasers are. Plasma pen is one of those things. We can't do microneedling. Also not do radiofrequency microneedling. Plasma pen is the only one for the upper eyelids.
Okay. Very good to know. So,
and eye creams are amazing, not to cut you off. Yeah, eye creams are amazing too, but like they only go so far.
right.
And there's some that are better than others.
Yeah.
I know I have my favorites.
Sure.
But these treatments are designed to build that collagen and elastin in the skin. And that's really essentially what we need to repair and continue to improve.
And at least there is some sort of treatment option for us. So,
Right.
do you know?
People don't know
Right.
that there's something to treat literally everything. There is something for everyone.
Right. You just need to get to a good esthetician and ask these questions and make sure. And hopefully this podcast will be helpful so that they have questions to even consider. Because sometimes you just go in there blind. You want to trust the professional,
right?
But you just you have nothing to even go off of other than maybe your friends that are sitting around or wanting to have Botox parties, and you're like, I don't know if I'm ready for that. Let me figure out some of these other options to do this more natural. So, eyelids is that an area that you do a lot with the plasma pen because it is the only treatment to really address that issue? What would be, and you may not know offhand, a potential cost for eyelids to have the plasma pen procedure?
So when we treat the eyelids, it's $400.
Okay.
For both.
Nice.
So I will say also to kind of piggyback off of what you were saying about the eyelids, we also treat a lot of the lower face and smoker lines, but a lot of times people will be like, I never smoked. It's from drinking out of straw as well. So we treat a lot of the upper lip around here. So
yeah,
I mean, I would say that's probably the majority. Plasma pen.
So healing time on that, you said is a little bit longer, and you see those dots for 8 to 12 days, maybe.
Yeah, I would say 7 to 12 days. So it's usually 7 days where most clients are saying they fell off, but even when those fall off, it does still kind of leave like a pink tinge to the skin. The day of the procedure, you'll be red like a sunburn again.
Does it burn after for a while?
You do, yeah.
I feel uncomfortable.
So we'll give you like a little jar of something to kind of help. Exclusive to help that healing process. Again, drinking your water, sleeping elevated, using your sunscreen.
Arnica is helpful too. Yeah, a lot of
arnica
balls use that.
Amazing for literally everything.
What about contact wears? Do you take those out during the procedure?
You don't have to.
You don't have to.
I will say, though, a question that I got asked a lot was some people kind of felt maybe a little tingling in their lower eyelid. It's completely normal. It just it'll subside after a while, but the next day following the treatment, you do swell.
Okay.
Whether that swelling is a lot
or there's an injury.
Yeah, exactly. You're creating injury to the body.
And that's so plasma is the liquid that is being created, right? When we have those. And that's actually what you use whenever you do the is it PRP? So it's kind of interesting. Yeah, that's what's going to heal. Yeah. And that's what's the swelling is. So you kind of want that. That's right. Healing that injured skin. Yeah.
You want all of it as well.
Yeah.
Unfortunately, but yes.
So downtime on that is probably a little bit longer. So when would you
give yourself 2 weeks.
Oh, no.
Definitely 2 weeks. I like 14 days. But
we need to have like a retreat where we all go somewhere, have these treatments, and then just chill for 2 weeks.
Yeah. Yeah, exactly. But I mean, so, like I said, I mean, you can go out in public,
Right.
you can do your normal activity. I mean,
Yeah.
like I said, there's sunscreen out there that has tint to it now.
Right.
So just make sure you check with your practitioner that
Okay.
it's good to use whatever it is that you plan on using.
Nice. So makeup could be applied after 48 hours with plasma
If you
pen or
absolutely need to. With plasma pen, I tried to wait a little bit longer, but if you absolutely need to, 48 hours is probably essential.
Would makeup even cover those dots?
Maybe not fully. I guess. I know what makeup you're using. Yeah. But I wear big sunglasses. Yeah, exactly. Or get like those glasses that are prescription. But in a little bit, just go outside really quick and come back in. But also, we don't really want to apply makeup over those until they fall off.
Gotcha.
So again, if you absolutely need to, okay. But if you can wait until those dots fall off until you apply makeup, that's really what you want to happen.
Okay. Yeah, and I mean, I think that's good for people to understand that there is going to be downtime with this.
So
but it's worth it.
Yeah.
It's definitely worth it to get your skin back to a natural, a more youthful state in a natural way instead of, injections and things that are a quick fix, but this will be more long term. And then is the plasma pen kind of like the microneedling and the IPL, like you do a couple treatments and then you are on more of a maintenance schedule?
So I would say 1 to 3 treatments off the bat. And sometimes clients are okay with 1 treatment. It just really depends on what are we treating.
Okay.
Another thing that I want to add in about the IPL actually and the plasma pen is that it is not safe for everyone.
Okay.
So when you are, and I'm not sure if everyone knows, like what is a fit scale? Fit scale is the color of your skin, your background. It ranges anywhere from 1 to 6.
Okay.
When you're treating with plasma pen, it's not always safe.
Okay.
So that's why it's good, again, to have a consultation. The same with IPL. So IPL is targeting pigment in the skin. When we are treating with the IPL and treating browns, if it's seeing that in the skin, it's going to mistaken it and it's going to burn the skin. Oh, so it's very important as well. And what you were saying, go to someone that knows what they're doing, because if you're treated with the wrong approach, it could be worse, right? Yeah, absolutely, because we're going way, way backwards then, and we're having to heal the skin and then start all over. And sometimes when those things happen, it's really hard to get a client's skin integrity back to where it was.
Or even get them to trust to go back to someone because they're so scared of what happened.
You're right.
So, just be really smart in who you're choosing as your esthetician. I think the aesthetics is so popular today, and everybody is doing it. Yeah, everybody's getting their esthetician license. Not to say that there's not a place for it, but the medical aesthetic part is really what we're focusing on today, if I'm terming that correctly. But it's aesthetics, but it's kind of going a little layer deeper and giving, because you guys have certain certifications and you have nurses and a doctor that oversees those med spas that is watching these processes and training you guys properly. So it's good to go somewhere reputable. So this has been so fun. Do we want to go down the chemical peel trail just a little bit and talk about chemical peels? So are chemical peels going to address fine lines and wrinkles as well as pigment, or are they more like on a pigment side of things? So, I always get confused with this.
So there's so many different types of chemical peels out there, and we can always get into that another time as well. But there's ones for pigment that have kojic and ascorbic acid in it. But actually and that's another thing too, you cannot treat all phases with chemical peels equally, because you are going to burn the skin. So again,
because you're losing skin, right? You're taking the skin off, and there
are chemical peels though that do have no downtime. We actually have one. It's from Skin Better Science. There is no downtime to it.
Wow.
Which is pretty cool. It gives you a nice glow. You might get a little dryness from it. But it just depends on the client.
Nice.
And then we have peels that you peel from 2 to 7 days,
Right.
starting on the second and third day. It
Okay.
just really depends. Sometimes it's what your skin needs to do. You could, even when I do chemical peels to myself, I could peel a lot one time, and then the next time I don't really peel at all.
Okay.
My mom, who just, God love her, just started letting me do treatments to her,
Yeah.
which I'm like, let's go, let's go. Um, she got a little dryness one time. They really hardly did anything in the past like 3 years, and I'm like, why didn't she peel them up? It's just what
Yeah.
your body wants.
How hydrated you are, probably for women, what part of your cycle you're in, which actually I wanted to bring that up when we were talking about pain, which probably isn't a great word to use, but
Mhm.
I know back when I had microblading done on my eyebrows, the girl was like, don't come when you have your period or you're on your cycle because you're way more sensitive.
You're right.
So maybe schedule these more sensitive types of treatments when when you're not like menstruating, you don't have your period, so that
Yeah,
at least the pain level is a little less. And I definitely know that is absolutely true. And
yeah, it is.
redheads actually feel more pain. So I know sometimes it takes us a little more to get numb.
Mm-hmm.
So we bleed a little bit more. Those are all knowns and you probably see all kinds of things based on
Right.
pigments of skin, and you probably learn skin types and how it reacts to different treatments.
You're right. But yeah, you're right. In regards to like that time of the month and the cycle and everything, because even when I do laser hair removal, it's the same thing.
Oh, really?
Telling you a week before, a week after. I mean, they're like, why does this hurt a little bit more? But
Yeah.
that's why. But with chemical peels, you don't have pain with them.
Right.
Essentially, when we're applying the chemical peel,
Mhm.
you could feel that burning sensation, but
Yeah.
it should subside. You could feel it a few hours following.
Okay.
But again, back to making sure that you're treated with the right chemical peel is crucial, because you could really hurt someone's skin and damage it. One of my favorite peels are the VI peels.
Okay.
It's a company that creates these peels that are good for every skin tone.
Mm-hmm.
It's super cool. They actually have a collagen inducing peel. They have one for acne. They have one for active acne, for scarring. They have one for melasma. Melasma is so tough to treat.
Yeah,
And I actually wanted to touch on that a little bit too. Melasma is tough. And
can you explain to people who maybe don't know what melasma is, what it actually is?
yeah, so melasma is essentially a pregnancy mask. I've had some clients come to me that said that their dermatologist said they had melasma, but they never had any kids.
Okay.
It's very important that someone knows what they're doing. And when someone comes to me and has a consultation, and if I even suspect, I'm not a dermatologist,
Right.
that they have melasma, and I'm looking at their skin, I mean, I know what it looks like. And if it's even questionable, I am not treating you with the IPL.
Okay.
Because the IPL is actually, it can make it worse. And that's
So
why
is
I
the
love.
pigment like brown and white? Is that, I don't even know if I've ever like.
Kind of. So it's kind of different on everybody, but you can basically see it right here. Sometimes it's a little bit more, and it's usually like they call it the pregnancy mask.
Okay, so just like
So
you'd be wearing a mask.
Yep,
Okay.
you got it. And like I said, clients don't even know sometimes that they have it. So that was the first question that I asked. Do you have melasma? Does anybody ever tell you that? Most are like, I don't know. Nobody told me that.
Yeah.
But I automatically X out the IPL, and let's do the VI peel. The
Okay.
VI peel, again, they have one for melasma, which is amazing.
Okay.
So there's literally a peel for everyone. So I think it's a great approach.
Right.
You actually don't peel for 3 days, and then you peel for 3 to 4 days after.
Okay.
It's super.
So
Have you ever
that's,
done it?
I think that we had a really light one we did.
Yeah.
I don't know. I think someone in Rev might have done it on me, but I get a little funny about those, but I am definitely, the light one sounds great for me. You know,
Yeah. Yeah.
I don't like downtime.
Skin Better Science actually has chemical peel pads that you can just use.
Ooh.
You know,
I like to come to you.
Yeah.
I actually am due for a facial, and that's even something we can talk about too. Like some of the treatments we're talking about are a little more of something that you have to like commit to, I guess I would say, because you might be doing a treatment or two and there's some downtime, but you guys have some really good facials where I feel like I get really good results. And I don't know why the name is escaping me now, but it's the one like suction.
The glow facial.
Yeah, the glow.
derm.
I get both. I think I combine them. It's the glow facial. But you do all kinds of things in that facial, and it's really good. But I always feel like when I come out, like my skin is so buttery, and obviously,
because we're exfoliating the dead skin cells off. I'm rejuvenating the skin, infusing it with things, and then with the microderm, I mean, you're basically taking off all the dead skin cells, which you can do dermaplaning with as well. And dermaplaning is great because you're removing the dead skin cells, removing the vellus hair.
I don't recommend doing that on yourself because the other day, I was getting a spray tan and I was like, oh, I'm just like a little fuzzy. I'm going to try. I had one of those things and I did it. And I was like doing it so fast and I literally cut myself. And I was like, you've got to be kidding me. I sliced my face. How dumb. I'm like, I need to go see Jenn.
Oh, yeah, you're right. Don't do that by yourself because...
Well, you can make it worse too.
Yeah.
You did tell me to go with the hair, but I'm not an expert, but I was like, I was going to get like a little.
And honestly, a lot of those little razors that they have those at TJ Maxx. Yeah. They have them everywhere, but they actually have little teeth in them that can create little micro tears as well, which a lot of people don't know that. You might never see them, but they're there. Right. So the dermaplaning tool that we're using is a surgical blade. So it's very close to the skin and they're,
Yeah. Oh, I know. It's so much better.
Yeah.
Well, and I did it about, halfway.
But also I wanted to add in too with the VI peel, there is a body peel, which is really cool. I've used it for my...
Like you use it on other parts of your...
Yes, you can use it all over. I do a lot of what they call back knee.
Yeah.
So it's awesome.
Wow.
Such a cool experience for the because again that's something that they don't, and you can do lasers and things like that on different areas of the body as well, but a lot of people think that they can't have a peel.
I would have never thought about that.
It's awesome.
So why
you can use it for stretch marks too.
Oh, really? Okay. So it will help with...
I've actually done it on myself. I've done it on my abdomen. So pretty cool.
So it helps with the integrity of that skin there.
Same things. Stretch marks, fine lines, wrinkles, pigment, scarring. You can do it on your inner thighs. Wow. You can do it. I've done it on people's butts. So
Oh, I know. There's all kinds of fun things that you can do. That's awesome. No, this has been fun. Is there anything else that you might want to add? Testimonials or let's maybe give our listeners something like, if you are brand new, like you have never even had a facial, like where would they even start?
So I would say if you are brand new and you've never done anything, come see me. We'll do a consultation. You can start with a facial and then let's talk about what is something that bothers you, what is something you want to correct, rejuvenate, and then we can go from there. There's so many treatments out there that we can approach. Again, it doesn't have to be one thing fits everyone because of pain, cost. There's some of the things are costly.
Right.
They're well worth it. Well, I'll find the best approach for you. And we'll treat it that way. But a facial is a great way to start.
Yeah.
Again, some clients are using products that are not even associated with what they're looking to correct.
Sure.
There's so much out there. And, with social media today, we're all listening to it and we think that we can do XYZ, and it's not always a thing.
It's too much information. It's like information overload.
Right.
You don't know what to try. Everybody's rolling their face and cutting the hair off.
Right.
And we're just...
I will say, though, the best thing that you can do until you go see a professional or start on your skincare journey, it's whether you're rejuvenating or correcting and maintaining, is wear your sunscreen.
Yeah.
A lot of clients think, and I say this all the time, and I get the answer all the time. I'm like, are you wearing sunscreen? And they say, oh, it's in my makeup or it's in my primer.
Sure.
It's not enough. We don't know what is the total amount of sunscreen that you have in your makeup. I don't even know if they know.
Right.
So Color Science is amazing. I know that you have some sunscreen as well on your website. So definitely check Jenn out. Because it's true sunscreen.
Right,
and it's going to protect. And when we talk about melasma clients, those clients need higher SPF because as we can do as many treatments as we want.
Right.
If you go out into the sun and you are not protecting your skin, there it all just goes.
So would that mask get darker and everything else stays lighter?
You got it.
Oh, wow.
Yeah. But sunscreen is the best thing you can do if you are out walking your dog or going to the beach, protect your face.
Yeah. Put a hat on, right?
Something. Honestly, girls look so cute.
So cute. And sunglasses. Yeah. Mm-hmm.
Yes.
Yeah.
And I feel like it's just so underrated, but I think it's such a cute look. So definitely utilize your hats. And I mean, you don't have to wear them all the time, but
right. Yeah. No, that's
as much as you can.
Good. Yeah.
I think it's great, but sunscreen's huge.
Awesome. No, this has been,
the sunglasses are going to help crow's feet too.
Yeah. Right.
Yeah. But
yeah, we want to avoid the wrinkles. I mean, sometimes there is some beauty in, like, I remember like my grandma and my great grandma and just loving like their skin. There's something about age skin as a child that I was it just, I don't know, it was comforting because I don't know, we used to like to play with that skin. But I feel like it's a different generation now. We're trying, and women look younger. Like I see some of these women that I follow.
40 is the new 20.
What? And I'm like, how do they look this way? But technology.
Right. Technology. And you're finding more and more women and men protecting their skin.
Right.
It's not like our grandmothers who could just use Olay and have no procedures and their skin is like porcelain.
Yeah.
It's not like that anymore. Look at our environment.
Right.
Everything is
everything.
We can't take that approach.
Yeah. Well, just the blue light from our phones is aging us. So, yeah. Well, this has been such a fun conversation. We'll make sure that we link up your bio, how to get in contact with you, the med spa that you work at. We'll make sure we have all of this linked up. And this has been a great conversation. So fun having you. Thanks for taking the time out of your busy schedule to join us today.
I love this.
Yes. And we will have you back again, right? Awesome. We want to dive into some deeper convos with the aesthetics world and maybe some subjects that might make some people uncomfortable. Like we want to talk about Botox and fillers and risks and what that looks like, because some people are curious about it and want to understand how some people have this result. And so we want to have some honest conversations about that. But thank you for joining us. If you liked this podcast, please share it, leave us a comment below, and make sure you subscribe to our content and we'll keep bringing you more.